Welcome everyone. I'm Vito Ilacqua. I'm a scientist in the Indoor Environments Division of the Office of Radiation in the Indoor Air at EPA. And working on indoor air, one of the questions that we receive most often from the public, but also comes up in professional organizations as well, is really the value of using indoor air cleaners, particularly after the pandemic. And in particular about indoor air cleaners, those that are using newer technologies that are less established than mechanical filtration. So we have two webinars planned on this topic. Today, we are delighted to have Dr. Jimenez finally join us, and next month we'll have a presentation on EPA's own research and regulatory aspects of air cleaners. Dr. Jimenez is a distinguished professor of chemistry at the University of Colorado in Boulder. His research is vast and covers many areas, but certainly in terms of indoor air and atmospheric chemistry, and you have seen much of his work also during the pandemic. He was one of the first to put out tools that could be used for people to calculate what is an application, how can we be safe in indoor environments. He's a highly cited researcher and a fellow of the American Association of Aerosol Research and the American Geophysical Union. And before I give him the platform, just a couple of reminders. First, I must emphasize that the views expressed in the presentation are solely those of the speaker and don't necessarily reflect the position or policy of EPA. And second, this webinar will be recorded, and typically wait for a couple of weeks. You will receive notification if you were registered for this webinar. And you can also find this recording searching the EPA site on indoor air quality and following the links on the webinars. You are free to ask questions throughout the presentation. Just type them in the chat box. We will have to compile them because of the size of the audience today, but they will be asked after Dr. Jimenez's presentation. And I think with that, we are ready to start. Jose, the floor is yours.
Well, thank you very much, Vito, for the introduction and especially for the invitation to speak to people today on what I believe is a very important topic. Setting up my timer so I don't go for too long. So I'm going to talk today about the health benefits versus disbenefits or harms from indoor air cleaners. And I'd like to start by acknowledging my co-authors, in particular, Dr. Jie Peng, who's really an engine behind this work. So my animations, okay, there he is. And we have been working very closely, and he's been doing a ton of work on a lot of the, all the pollution simulations. Darren Hensey, a professor here who's an expert on health effects, and I've been his grad student all this time. And he's been coaching me on how to do that correctly, and Jose Gao, who's my co-PI. And I also like to acknowledge the funding from the Valvi Philanthropic Fund, the Sloan Foundation, and CIRIS. Okay, so I'm going to follow this outline of the webinar. So start with the introduction and then follow with disinfection, then air pollution, then we will calculate the net mortality benefit or disbenefit. And there is this grid at the bottom that's going to tell you where we are. Also, all the slides have a slide number here in the corner. So if you ask a question about a specific slide, it will help you say, okay, in slide 21, you said this, but I don't understand or I disagree or whatever. That may make it easier to sort the questions later. And actually, I'm going to turn off my camera. I was told that I would make the bandwidth better. Okay, there we go. So, there we go. Now, before I get started, I want to have some notes and disclaimers since the topic can be controversial. I don't have any conflicts of interest, meaning I don't receive funding from any types of air cleaners, and I work hard to keep it that way. This is a very complex subject, as you will see. So don't worry if you don't understand some of the details of how things are done. There is more detail than I can present here, but just I will still keep summarizing the big picture and the patterns and the key numbers. We're going to analyze technologies. Many air cleaners combine different technologies, but we're going to analyze them separately, which in some air cleaners you can find them that way. I'm not going to mention any brands or any models, but all of the results are based on real tests with real devices that are commercially available. I'm not going to endorse any brands or models. Please don't ask me to provide you with which one I recommend. I can't do that. This work is being prepared for peer-reviewed publication. So if you think something can be improved or have papers or reports that you think I should take into account, just send them to me. We have tested some, and we want to test more air cleaners in the lab and the office. If you have some air cleaners that you would like to have tested and you can share them, loan them to us without restrictions of publication, then please email me. And actually, something that I have not been able to find is information on the market share of different technologies. So if you happen to have this information, again, let me know. And we will answer questions at the end, but if there are more questions that cannot be addressed at the end, I will answer them on Twitter with this handle JLJ Colorado or in LinkedIn once the EPA has posted the recording so that other people can see that. Okay, so without further ado, let's talk about indoor air. So during the pandemic, we were told at the beginning by WHO and the CDC that this virus was going through surfaces or droplets that fell to the ground in 1 to 2 meters. It was later shown that this was completely incorrect, and really the virus is dominantly airborne. We're breathing this virus in, and many people worked on it. These are 2 papers I'm particularly proud of that were led by others, but where I participated and helped basically establish this fact. So during the pandemic, of course, we were all, including myself, all obsessed with airborne transmission, but there are other reasons why indoor air is important for health. One of them is that there are many sources of indoor air pollution, and this causes also mortality. And one that has been in the news recently is gas stoves, but there are many others. And in addition, outdoor pollution is one of the top causes of preventable deaths globally. And much of the killing of outdoor pollution happens through breathing that when it gets indoors, because we spend 90% of our time indoors. So if we could remove the outdoor pollution that gets indoors, that will have a big benefit. And that's made more obvious recently, for example, when we have these events with high forest fire pollution. So during the pandemic, we were like, okay, Houston, we have a problem about the disinfection. And, we did have a problem, but what we forgot and what many people forgot is we didn't have a problem. We still had 3 problems, So some of what I will show you is some technologies, some things that were developed and sold work for everything in the background. Some only work for disinfection, and they don't do anything for pollution, or they actually make pollution worse. And that's going to be a big problem. Okay, so let's switch into airborne transmission very briefly. So what happens is that this person is infected. These red dots represent the aerosols that have the virus, and people either in close proximity or that are sharing the room air can get infected. You are more likely to get infected here, but a lot of transmission happens in shared room air, and actually ventilation or air cleaning affects the rate of infection even in close proximity, because some of the virus that we breathe in is the one from the room. Large droplets are mostly a myth. They don't do much. I've given very long talks on all the details. If you go to this link, you can find some slides with many links and papers, but I will leave it here for today. Now, the virus is floating in the air. We don't want to breathe it in. What can we do? So the worst thing we can do is to keep the air with the virus and the pollutants and not do much about it, keep low ventilation. This seems not very smart, but unfortunately it's what we do most of the time in most places. We have, most homes, and many places are poorly ventilated, and we're just breathing the stuff in, and it has significant health effects. Something that works well, as long as the outdoor air is not very dirty, is ventilation. So opening the windows or with mechanical ventilation, and here the virus or the pollutant in different colors go out there. The air goes, and with it goes the virus and the pollutant. Okay? I'm not going to say much about ventilation because that's not, I'm going to talk about air cleaners, but I wanted to say one thing. And it's like in most places in the US, you go to a restaurant, a bar, a library, this is what you see. You're not aware of the ventilation. As long as there is a very low amount of ventilation, that's enough to remove bad odors. You just don't know what's going on. I think that's a big problem. And we've been advocating since the beginning of the pandemic with many other people to make ventilation visible. And this is not hard, it's cheap. All we need to do is everywhere where we share air, put a CO2 meter in the wall that tells us how much air we're sharing. You know, basically as the CO2 goes up means more of the air that's in the room has been exhaled by others. Okay? It's not perfect, but it's cheap. It will make us aware. For example, if the ventilation system breaks, in many places the ventilation system breaks and it takes 2 years for someone to notice that the outside air damper is broken. You know, and here we would notice the next day. Okay, but let's go back now to air cleaners. So there's basically two types. One is we're going to keep the air in the room, but we're going to remove the virus and some pollutants by going through a filter. Okay? So the air that we will breathe will no longer have the virus, or will have less. Now, something else that is strictly called disinfection is we're going to keep the virus and we're going to actually keep breathing it in, but we're going to kill the virus or deactivate it. So when we breathe it in, we're no longer going to get infected because there is some technique, in this case UV, but there are many ways to do it, that has killed the virus. Now, this technique that's killing the virus in some cases may increase the level of pollution. Okay, so how do we model the disinfection by the air cleaners? So, and also the pollution, we're gonna take information from many peer-reviewed papers or reports when there are no peer-reviewed papers. And we are going to distill a bunch of numbers, which are shown here. I'm not showing you which air cleaner is which or what number is which, doesn't matter, but you can see that the air cleaners are very different in many different ways. And with those, we're going to run them into a model, a box model of a room where we assume the air is well mixed, and then we're going to calculate the transmission and we're going to calculate the pollution. Okay. So for the disinfection model, and here I'm going to switch the meaning of disinfection to include also filters. Anything, you know, to contrast it with pollution. Anything that leads to less disease is going to be disinfection in this part of the talk. So we're going to assume we have a 300 cubic meter room, the size of a larger classroom, and we're going to have an amount of ventilation that's going to change a lot, between 0.1 and 30 changes per hour. We are going to assume that we are going to put an air cleaner in a random 1% of US indoor spaces, okay, across the population, across all the other characteristics. So, and as I said, and we're going to assume that we can prevent two-thirds of the transmission, that there is, you know, 50% of the transmission goes through shared room air, and then maybe a third of what happens here we can actually prevent with the air cleaner, two-thirds we cannot, okay? So that's going to be an assumption, and I think there is literature to show that that's reasonable. Now we're going to introduce the air cleaner, and we are going to introduce one or the other different technologies in isolation. And each air cleaner is going to be quantified by a quantity we're going to call the equivalent air changes per hour, or EACH. Okay? What does this mean? Each air cleaner has a clean air delivery rate. It's going to produce a certain amount of cubic meters per hour or cubic feet per minute, a certain amount of air that doesn't have the virus per unit time. If you divide that by the volume of the room, then you get how many times the air in the room is being cleaned every hour. And this is an example of what happens with a pollutant or with the virus under different values of this number, right? So we have 1 air change per hour. That means after an hour, 2/3 of the virus or 2/3 of the pollutant are gone, and the rest will take a while longer. If you have 5 air changes per hour, it happens 5 times faster. If you have 0.2 air changes per hour, it's much slower. So you see this number makes a huge difference on how quickly we remove the virus or we remove a pollutant. Okay. Now, how many people can we save? How much disease mortality can we avoid? Okay, and we're going to focus on mortality because, I mean, airborne disease like COVID has long COVID and many other impacts, but so does pollution. Pollution causes asthma and increases the rate of Alzheimer and many different things. So just to keep it simple, we're going to focus on mortality because that's the easiest, the first order calculation, and it's obviously important. So I already told you this, and we're going to use rates in deaths per year, okay? So we're going to apply the air cleaner for a period, and we're going to calculate the deaths per year, and those will be the numbers I will show you. Now, sometimes people say, well, I would only use the air cleaner for a month when the disease is bad. It's okay, the numbers still translate. You would just get a 1/12 of the benefit and a 1/12 of the disbenefit, okay? And so it all transfers. And we will show some sensitivity cases with extreme disease levels. Now, how much disease? So the base case is going to be December 2022, where we had a pretty big COVID wave in the US. According to the CDC, 110,000 deaths per year. That was the rate, and then some from the flu. And 1% of 130,000 is 1,300, but we can only avoid with an air cleaner 2/3 of that, so that's 666, which is this number. And then we're going to do some sensitivity studies, high risk. So this is the first year of the pandemic where the deaths were much higher, and low risk, which is this summer when the rates were lower and the deaths were lower. And so this is going to matter in terms of the benefits. Now, in terms of the model, we're going to build on the model that we published. Again, work led by Japan in collaboration with many colleagues that has had a big impact, except I should say in the medical community, they keep ignoring it. But anyway, that's a different story. And here, each one of the data points is a super spreading event, the famous ones that you have seen. And 100% means everybody got infected, 0 nobody. So it's the percentage of the people that were present in that room that got infected. And this is an infection risk parameter. And one of the big contributions of this paper was to show rigorously that you only need one number and you can combine all the dependencies in one number. Now, each of these is a super spreading event. Again, these are all the famous ones, the call center, the buses in China, the choir in Washington, the study led by Shelley Miller that we published, the meat packing plant in Germany. And you see that they all follow this airborne transmission model. I should say they follow it very well for being studies done by very different people and published. So, so we have a model of disease transmission that's credible, and so we're gonna then use it to predict the impact of air cleaners. How do we do that? This is the model. I know it's an ugly equation, and the risk depends on many things, but we're gonna assume that we're doing this in a random subset of places and that everything stays the same except the air cleaner. This is another term for the EACH. So we're going to increase this or change that, and that's going to change transmission. And as you see, the risk parameter is divided by that. So for example, we're here in a place with low ventilation, and we have that risk parameter, and now we add an air cleaner that has 5 air changes per hour, so we're going to go up to there. So we were in a place where maybe 40% of the people were getting infected, and we put the air cleaner, now only 10% of the people get infected. So we're going to have a quarter of the infection, and we're going to assume that if we have a quarter of the infection, we have a quarter of the deaths. Excuse me. We're assuming it's only 1% of the population, so we're not going to flatten the curve, but we're going to just linearly reduce the number of deaths. Okay, so we have this model, and then we are going to have all the results are going to be in this 2-dimensional space. The ventilation rate is going to matter a lot, so I'm going to show it in a log scale from 0.1, which happens in some homes, to 30, which is very, very high, almost unheard of. And then here in the x-axis, we're going to have the equivalent air changes per hour. Both axes are logarithmic, meaning things are changing a lot. This is a factor of 300, this is a factor of almost 1 million. Okay. And now I'm going to add some coordinates here. So for the equivalent changes per hour, I'm going to use a CDC recommendation of 5. There are other recommendations that are all under this ballpark, which is not perfect, but is something that maybe can be done cost effectively and can reduce disease by a lot, as I showed you a moment ago. Okay? Now, what about ventilation? So this is a little complicated, but I'm going to show you some examples. So the average in the US from a recent review is about 0.7 in homes. Now there is a wide distribution. Some homes are at 0.1, especially newer homes tend to be tighter. And then some are at about 2, so somewhere in that range. Now commercial spaces tend to be higher. The average will be about 1.7. One of those would be schools that people of course care a lot about, and that's about 2.8. Now all commercial spaces, if they follow code, then they follow this, they tend to see this ASHRAE 62.1 standard, and then they would encompass this range. Okay. So in the following, I'm going to say, okay, the average commercial and home, I'm going to use a value of 1 as a typical value. Okay. Now, there is also hospitals where airborne disease, is fought more vigorously. And in a modern US hospital, the ventilation rate is going to be something like 6 to 12. But we won't concern ourselves with those, although we could run the model for that case. Okay, so we have the model and we have these assumptions. So we put those together, and now in this space we can produce a 2-dimensional plot of how many. So the numbers here are how many deaths of airborne disease are avoided if we use any air cleaner. And this plot is the same for all the air cleaners. So let me take a moment to explain this colorful plot. There's going to be a color and there's going to be contours. They are the same quantity. So the color guides the eye and the contours give you the numbers. Okay? So they are all going to be the same. So this means 1 death avoided. This means 400 deaths avoided for this 1% of the US population. Okay? Again, positive numbers are always death avoided. If you see negative numbers, those are deaths caused by the air cleaner. Okay? Don't worry, you see something in the model and say, oh, that number is a factor of 1.5 or 20% or a factor of 2 of. That's not going to matter. This is a factor of 2 in the X direction. This is a factor of 2 in the Y direction. You see that things don't change so quickly in this space. Okay? So we're really trying to find the orders of magnitude. And as my son used to say when he was little, the differences are going to be very enormous between air cleaners. Okay, and this is going to be the typical US ventilation. This is what the CDC recommends. So I'm always going to be highlighting a number at that intersection, again, just to make it easy to follow. And what we're going to find is that if we operate under those conditions, we can save 300 people from disease. We don't get the full 860. To do that, we will need more intense air cleaning and to be in places with very low ventilation, right? But for this situation, where we do decent air cleaning and we have some average ventilation, we can save still 300 people from disease compared to not having the air cleaner there. Okay. So let me explain this plot a little more. So this is a 2-dimensional plot, but we can cut it on the X direction. And we see as we go in this direction, the numbers increase. So this is now the cut, the 1-dimensional plot. And at that point I was mentioning over here, we are at 300. Now we can cut on the other direction. And again, as we go in this direction, the number increases. So again, the same thing, and these 300 are. So anyway, just to make sure people are following. Okay? So what I'm trying to get at, so this is all I will do for modeling disinfection. This is relatively easy. Pollution is a little more complicated. So for every one of the air cleaners, we're going to have this benefit of air cleaning. That's going to be the same once we put things on equivalent ACH. And we're going to have the benefit or the harm of pollution. In this case, this is a result for one air cleaner in which actually it increases the deaths. That's why we have negative numbers. Okay, so we're going to then sum them. And for each condition, we're going to see, okay, do we get a net positive benefit? Do we save more people from airborne disease than we kill with pollution? For this particular air cleaner, that is one of the real air cleaners that I will show you, things look pretty negative. All of the gray area are negative numbers, and so we are killing more people than we are saving. The red line is going to be a boundary between no benefit. The blue area or the color area is going to be a positive net benefit. In this case, that's negligible. Okay? And again, in this case, we have a value of minus 417 because we were saving 300, but then pollution is killing 717, so the negative effect, the net effect is minus 417. Okay, so I'm telling you what I want to do. Now I need to tell you a little bit of how I'm doing this piece. Okay, how are we modeling the air pollution? Okay, from the air cleaners. Okay, so we're going to again use a model of the same room, and we're going to use the values that are the average of the US outdoor and indoor air. These are values of outdoor air. These are typical values from the scientific literature. Again, we're going to have the same values of ventilation, volume of the room. In indoor air, we have emissions, for example, of inorganic and organic species from us, from people, from surfaces, from materials, from air cleaners, from products that we use. Limoning is going to be an important one. And again, these come from many, many measurements through the years, and they are reasonably well constrained. Now, some of these pollutants are going to be lost to the walls or to the surfaces, and these rates, again, these are the rates at which they're lost. And again, these are reasonably well constrained from the literature. Now, there's going to be chemistry that happens, and one that's very important is this limonene is going to react with ozone or OH that either come from outdoors or are generated by the chemistry or are generated by the air cleaner. And this is going to make particles, and particles are a very nasty pollutant. And again, we are going to quantify everything with the ACH, the air changes per hour. In this case, it's not for disinfection. It's going to be a different number, which is going to be for pollutant X, and there may be for particles or for ozone or for other pollutants. Okay, this is if the air cleaner actually removes pollution. Some air cleaners actually generate pollution, in particular oxidants, ozone and OH, and then in that case, they don't have an ACH, they have a negative effect. Now, both models are simplified, but you know, they're realistic, and I'll show that they compare well with observations. And very importantly, they are the same for all the air cleaners. So you may say, well, this aspect of them is not perfect. Well, it's not perfect for ionizers and filters and UV and everything. It's the same. Okay? Now, I have to say we're likely underestimating the pollution impacts because we're accounting only for ozone and particles. We're not accounting for NO2 or formaldehyde or ultrafine particles, the very smallest particles within PM2.5 that seem to have increased health effects. But anyway, this gives us, this is what can be done most easily, and it starts to give us a sense of what's going on. Okay, now we have some standards. So some people, when we bring up the issue of the pollution, they say, well, maybe this air cleaner produces some pollution, but if you have a little ventilation or if it complies with this or that standard, then this is not a problem. And people mention many different standards, you know, all of these that I list here, I will show some of those, or sometimes they it's FDA registered or UL tested, or is deployed by NASA at the space station. And I have to talk to my NASA colleagues because they have deployed some less than useful and potentially dangerous items at the space station. I'll show you in detail later, but the answer is that most of these do nothing to protect us, nothing, okay? And really well, I mean, they protect us from extreme, I guess I should correct that. They protect us from extreme situations, but really they don't do much to protect us. And there's only a couple that have some benefit, but this is an area that really needs to be worked on. And I think something that's critical is the standards of pollution of these air cleaners need to be normalized to disinfection. You know, an air cleaner that disinfects very efficiently, we can tolerate a little more pollution than one that disinfects poorly. Okay, so how do we know the pollution model works? Well, we're standing on the shoulders of giants. We really are building on the work of many in this community. And you know, and I feel in a way I've been working my whole career to give this talk because it really incorporates many different things that we have done through the years, and we have taken a long time to learn. But more concretely, for example, for all this oxidant chemistry that happens indoors or outdoors, we were working on that for some reactors that use UV and ozone, different things. And actually, Japan and myself were invited to write a review paper about this just that got published just as the pandemic was getting started. And actually, this pollution generating machine that we use in atmospheric chemistry now is being sold as an air cleaner, which I was shocked when I saw that. It's not a good idea. I'll show you the details later. Now, how well do we predict the ozone? So these are tests in an office when we were checking with UV. So the black is the data for the ozone, and then the blue is the model. And you see, you know, sometimes we undershoot, sometimes we overshoot, because you always have some ventilation, some variability. But you know, the model is credible for ozone. What about PM? Again, I was telling you limonene with ozone. You know, ozone, we have some pre-existing ozone, and then it increases when we turn this particular UV light. And limonene is going down and particles are going up, and the dashed lines are the model. So the model is also credible for particle pollution. Okay, so we're predicting the amounts of pollutants. Now, how do we calculate how much mortality we have? So we use work from epidemiologists that has been going on since at least the 90s. This is the famous Harvard 6 City study, in which Harvard researchers recorded the mortality rate, so how many people died in these cities. And these were 6 cities in the US, and then they plotted it against how much particulate pollution was there. You know, this was controversial at the beginning, but now it's very well established. So let's try to get a sense of the numbers. So I'm gonna just draw a line to guide the eye. I'm gonna say, okay, 10 was the lowest amount that was observed. So then by definition, the deaths don't increase because that's our baseline. Now, if you increase PM2.5 by 10 micrograms per cubic meter, which is just the unit that we use, so use 10, the mortality increases by 13%. So in that city, instead of having, you know, 1,000 people die that year, it's going to be 1,130. Okay, so this is quite a significant effect. It's a very strong lever on mortality, and this is why air pollution is one of the leading preventable causes of death worldwide. Okay. So now, when you think about these rates, and you think about 1% of, we're working with 1% of the US population, so 1% of the US non-accidental mortality, which is 2.6 million, is 26,000. Okay, so the case we're studying, there is 26,000 people who die. And if you increase PM 2.5 by 1 microgram per cubic meter, you are going to increase the amount of deaths by about 300. So if you have an air cleaner that increases PM by 1, you have negated the effect of this infection. Okay? Now, if you increase ozone by 1 ppb, which again people say, oh, that's so small, you're increasing the deaths by 23 deaths per year. You increase by 10 ppb ozone to 130. Again, you start to negate the effect of this infection. And what's important is actually these amounts are at the limit of what we can measure indoors. So much like it happened with the virus, that the virus was very difficult during the pandemic to measure it indoors, and the WHO experts didn't believe airborne transmission because it was difficult to see, and yet it caused a whole pandemic. So here we have a lot of mortality, and it's caused by amounts of pollution that are at the limit of what we can measure with research instruments. Now, we're not going to use this curve, we're going to use this more recent one, but the numbers are very similar. One thing that has been done, however, is that now we have some of the population is exposed to lower numbers, and so instead of 10, it's 2.5 micrograms per cubic meter that we start to have health effects. And really the indications is that this goes all the way to 0. But we will use what's published, which is below 2.5, there is no health effects. There is no extra mortality. Now, what mortality is this? Are we going to put an air cleaner and people are going to start falling dead and we're going to be able to see it? Well, it's not so easy. These are increases of the rates of mortality by, for example, stroke or COPD. So if we put one of these air cleaners in a hospital and we make a bad choice and it starts to kill some people with pollution, and the stroke rate increases from 10 people per year to 11 people per year, who's going to determine that, right? That's not possible. We can only study this from a population level using this type of relationships from the epidemiological studies. So how many people are we talking about, and how does it compare to the numbers we can save from disease? Okay. So if we remove outdoor PM, we were able to remove, if we remove all the indoor PM and ozone, we can save actually about 1,300 people with PM, a couple of hundred people with ozone. Now, if we have a year that we have, like in New York this year, a lot of days with high wildfire impacts, that increases the deaths a bit, so we can save some more people. What about the deaths caused by adding pollution by indoor oxidation? This is going to depend on the air cleaner, and the sky is the limit, or the bottom of the ocean is the limit. And I'd like to make one last point, which is that sometimes people say, well, again, ozone at low levels is not really damaging, and actually the opposite is true. This is a study published from data in China where they calculated how many deaths would be avoided if in China they could keep ozone, for example, always below 20 ppb versus what really is, we could save about 10,000 people. So for a study, this is a study that we published recently, so we had a base case that we had 5 ppb of ozone, and this particular air cleaner increases by 5. And people say, oh, this is so small, that's not a matter. If you did this everywhere in China, you would cause 25,000 deaths. This is China, not the US, but these low levels of ozone, low increases of low levels of ozone are very meaningful. Okay, so finally I've given you all my introduction, so we're going to start to see the results from actual air cleaners. Okay. I'm going to start with an electronic air cleaner. I'm not going to tell you which one it is. I will tell you later, but for now, let's just focus on the plot so we can understand the process. So this particular one makes ozone, and I'm going to use these colors to indicate it's negative. So this is the amount of ozone that's produced. So at this crossing, we get 29 ppb, and I already told you 1 ppb is a problem, 29 is going to be a big problem. This ozone makes particles, so we're going to make 0.3, and I told you a microgram is a problem, so 0.3 is still a problem. Now, how many people die due to this in our case study? So from ozone is going to be 614, so already more than we were saving with this infection, and from particles 701. We're going to sum the deaths from ozone and PM. Are going to be the total deaths from pollution is going to be 715. Okay. So now we're going to look at that question. Are we protected if people tell you, oh, but we comply with the EPA ozone standard or whatever? You know, are we protected by those standards? Well, this is if we meet code. We have enough ventilation to meet the ASHRAE code in commercial spaces. You can see that you can still have you know, thousands of deaths. What happens if we meet the particulate matter standard? Everywhere on this plot, we meet the EPA particulate matter standard, and still we can have thousands of deaths. If we meet the outdoor ozone standard from EPA, still we can have thousands of deaths. If we meet the occupational standard from ACGIH, we still can have lots of deaths. None of these standards are protective because this is, you know, this is 70 ppb, this is 50 ppb, and I'm telling you, 10 ppb is a big deal and it's enough to negate the effect. What about if it meets the CARB, California Air Resources Board ozone emission standard? This starts to do something, you know, but still at low ventilation we can have 1,000 deaths, so it's not great. What about if it meets what's called the zero ozone standard, which is not zero? You know, this starts to be better, starts to be protective, but at low ventilation, you still can have hundreds of deaths. So it's not great. None of these standards are great. Okay. So we still have pollution deaths with all of these standards. So there is a lot of work to be done with this, and I know ASHRAE and other organizations are working on this. Now, and I would argue this standard should be ratioed to disinfection because it's not the same to make an amount of ozone when you have a huge disinfection benefit than when you have a little one. Okay. So now, okay, so we've calculated, this is the disinfection benefit that we have. Now this is the pollution harm that I show you. We sum them, and this is how it looks for this air cleaner. We save 300, but we have 717 deaths. So we have a net negative impact of 417. All of this area is going to be gray. All these negative numbers, that means negative is more death. So it's going to be a net disbenefit. Positive is going to be a benefit. In this case, is very small. And here we're going to have a red line that separates positive from negative benefit. Here we have 417. So with this air cleaner, this is very bad. And this is not the worst air cleaner. There are worse ones, right? Now, some people will say, well, what? But you are simulating December 2022. Early in the pandemic, things will have been better. And it's true. So let me do a sensitivity study where we use the deaths from the first year of the pandemic. And then things do look better. So now you see more color. There is more positive impact here. The zero net impact is there, and we save 569. But this is the line, the contour of we save 50%, or we cause 50% of deaths for everyone we save. So, or in this case, we save 1,200 or 1,300 from dying from disease, but we kill 715 from pollution. Okay, so we have a net benefit of 169. You know, is this the best we can do? You know, is it really, if we have an air cleaner that in the worst of the pandemic, all it can do is save 2 people for everyone it kills, and well, you know, no way, Jose. There are many better air cleaners than this, and this air cleaner shouldn't be used, in my opinion. Okay. So I'm going to show you many of these plots, and they're going to be very, very quick, and you can focus on this number. Now, you can also look at them as a Rorschach test. You know, like something that looks like this, a lot of gray, is going to be bad, avoid it. Something that looks like this is like, well, there's a little benefit, but it's mostly bad. Something that starts to look like this, there is bad over here, but okay, maybe this under some cases. And something that looks like this, that's always positive, and we have big number, it's going to be good. Okay, so if things are going too fast, you can focus on that pattern. And again, I'll show you the number. Okay, so which air cleaners I'm going to talk about? So I'm going to talk about all these different technologies, and they all, as far as I can tell, they all disinfect air. There's none of them that's a scam. There are air cleaners that are sold that I think are scams, but not in terms of the technologies. All the technologies have the potential to work. Okay, and they will all avoid deaths if they are installed indoors from the disinfection effect. And they can avoid up to that many, the 866. Okay? Now, do they help or they hurt with pollution? And we have some that they help with pollution, and then we have many that they hurt. How much they hurt, it depends, you know, and some that actually do both. And this is, if they help, this is how much benefit we can have. If they hurt, again, the bottom of the ocean is the limit. It depends just how much they hurt. Okay? So those are always going to be positive. Those we have to look at the details. And when I say the details, is really this ratio of disinfection to pollution. If they are efficient disinfection, don't make a lot of pollution, they're going to be good. If they are poor disinfectant and very pollutant, they can be very bad. Okay? So I'm going to go through each one of them quickly. There is one that I couldn't finish the model. There is less information about, which are these HOCl foggers, in which basically is a spray of something like bleach. Is done a lot in the medical environment. I'm pretty sure those are going to have a substantial pollution effects. This is work from some colleagues in Toronto where they basically clean with bleach, and this produces this same hypochlorous acid in the gas phase. And they saw that when you do this indoors and just turn on the lights, this produces large levels of pollution. So if someone has one of these that we could borrow to test, I would love to have it. Now let's talk about the ones that we can simulate. So different types of filters. This is now a Corsi-Rosenthal box. I'll do it yourself or other types of filters. Again, what matters is the cleaner delivery rate. Don't let people fool you with, oh, ours is true, HEPA, whatever. That doesn't matter. It's the cleaner delivery rate is the only thing that matters. Okay? So you see that in this case we have a very good benefit. So we're saving 300 people from disease and 955 from pollution. So we have a very large benefit. Okay? So filters are good, but be aware of, again, the differences in cost. Noise is very important. You can buy things that have the same price and are much noisier, and then people turn them off. And a particularly favorable about Corsi-Rosenthal boxes that are much cheaper. What about activated carbon? This is something that removes particles and removes ozone. So the number increases a little bit because in addition to the particles, we are removing the ozone. Okay? Now, so activated carbon is very good. And I saw this and I was very excited because I have one of these that at home. And then I tried to measure the ozone and it doesn't do anything. And what I've learned talking to colleagues is like in many commercial air cleaners, activated carbon is a gimmick. They do have activated carbon, but a tiny amount. They have grams, and this does nothing. You need hundreds of grams or kilograms, depending on the size of the air cleaner, to actually do something. So be aware of that. Now, the next one are electrostatic precipitators. And this is kind of what you do when you want to have a filter, but you cannot tolerate the pressure drop. You cannot put a big fan, which is a problem under some situations. So you have a filter, but it's kind of full of holes. And for the filter to work, what you do is you produce lots of ions with a discharge. These ions attach to the particles, and then the particles go through these plates that are positively and negatively charged, and they attach to them. So it's like a filter. The problem is like a lot of these ways of making ions make ozone, and the ozone makes PM. But they remove PM. So I didn't know what to think about this. I thought they were going to be more negative, but I was surprised they actually look pretty good. It's not as good as a filter. Instead of 1200 here, we had 900 because the ozone is doing some damage. Okay? But under some circumstances, they could be useful if really filters cannot be tolerated, and especially we can do something to remove the ozone. Okay? Now we're going to start with the electronic air cleaners, and we're going to switch to ozone generators. So ozone generators, as the name says, they just make ozone. Ozone in the air disinfects. The problem is that it's a poor disinfectant, and you need huge concentrations of ozone. And ozone is a good killer due to air pollution, and ozone is a good oxidant, and it makes PM, which is also a good killer. So this is terrible, So this is where 5 ACHs are, and it's minus 1200. So we're saving 300 from disinfection, but we're killing almost 1600 with pollution. So ozone generators absolutely never use any time where people will be there, no matter how bad the pandemic. What about hydroxyl generators? So these are the pollution-making machines we use in atmospheric chemistry that I was shocked to find people are selling as air cleaners. Also terrible. In this case, 1086. Again, we're saving 300, killing 1400. This is terrible. Also, these and many others say, oh, we take the VOCs, the volatile organic compounds, and decompose them into CO2 and water. There is no air cleaner that can do that. They will need to be 1,000 times more powerful, and this is something we have studied and published on whatever. they are turning VOCs into more toxic VOCs that they can no longer measure with simple techniques. Okay? So do not use hydroxyl generators. I mean, again, these are my opinions, not the EPA's, as it was disclaimed at the beginning. Photocatalytic oxidation. So here we shine an UV light on the surface and produce some of these oxidants. This is the one I showed you as an example before. And again, it looks pretty bad, not as bad as the other ones, but again, 417 negative. So I would say, and we saw the case study where we used it in the early pandemic, it was still suboptimal. So I would say, avoid, there are much better technologies. What about ionizers? So ionizers put ions in the air. So it's like what the electrostatic precipitator does, but then doesn't have the plates to remove the particles. And then the regular ionizers make ozone, and they're again very negative. So again, they should be avoided. Now, what about the bipolar ionizers? 20 years ago, people realized that the regular ionizers made ozone, so they continue to be sold, but some people develop bipolar ionizers. Some of those still make ozone, others do not. It's unclear whether the ones that don't make ozone make byproducts. There's a company that sues anyone who wants to study this, so it's become difficult. But in any case, they all do some disinfection, but it's very small. So in our classroom, you could pay, or in our study, you will have to pay $2,000 to get 0.2 exchanges per hour. So if you want 5, what the CDC recommends, you will need to pay $42,000. So this is extremely expensive. It's 400 times what you would pay for a Corsi-Rosenthal box. Okay, so I would say this is, don't use ionizers. They have negative effects. Bipolar ionizers, they are unclear, but they are extremely expensive. You can do much better than that. And in addition, the mechanism of disinfection is not understood. We're always scratching our heads. How are these ions disinfecting? They're doing some chemistry. And what we know from, we use ionization daily in our research. And we know that what happens in ionization depends on which molecules are in the gas phase. So the disinfection may happen some of the time or may not happen some of the time. So we think they may be unreliable. And what people see on some tests may not be what happens in the real world. So I would recommend avoiding these. Okay, so we finished with the really bad ones. What about germicidal ultraviolet? So, and there are two types. One is the traditional that we've been using for 100 years, pioneered by William Wells in 1930s. So in this case, we have light from 254 nanometers, one of the wavelengths, and this will burn your skin. So it's done in the top of the room, so then the air goes up and down and gets disinfected. Now, it is, if you operate it at the CDC recommended amount of 5 exchanges per hour, it's pretty good. So it's not 300 because, we do save 300, but then there is 5. The pollution kills 5. Okay, so it's pretty good, but it does have a little bit of mortality. Now, one issue is that this is the CDC recommendation for SARS-CoV-2, let's say. But there is another CDC recommendation that was based on work by Shelley Miller here in Colorado for tuberculosis. And Ed Nardell at Harvard has another recommendation, and these are based on tuberculosis. Tuberculosis is much harder to kill with UV than SARS-CoV-2. And in those cases, we have to work at higher levels. And at these higher levels, we end up working in this regime where instead of a couple of deaths for every 100 we save, here we have 10 deaths for every 10 deaths for every 100, or 1 death for every 10 lives that we save. So we say this is not ideal. We don't want to be doing this all the time. There are mitigations that you can do. You can couple this with filters and activated carbon and other things that I don't have time to go into, although we have simulated them, and it helps. But still, I would argue that for general purpose, it'd be better to work at these levels and reserve these very high levels for really when you're really dealing with tuberculosis or immunocompromised patients or things where you really need those high levels. So the last one I will cover is germicidal UV at 222 nanometers. So this was new, the last 10 years, and it has had a lot of attention during the pandemic. The key advantage that it has versus the 254 is that it can be shown on people, because it's absorbed by the dead skin, on that layer of skin. And it's still being debated, but it seems reasonably convincing to me that you can actually shine this on people at certain levels. And then the problem is it generates ozone, which generates PM, and actually 2 papers got published on this, one from our group, another one from NIST, with the same results. There's another paper from MIT that's being reviewed that has the same results. So we know pretty well how much pollution this creates. Okay, so now we go to this space. So we see they mostly look positive. Here is the 0. So they do turn negative at 30 or 40 ACH under some conditions. The number here is 280. Yeah, so we save 300, but it causes 20 deaths, so it's 280. This is without adding filters or anything else, right? So it's good, but it has a penalty. Okay. Now, that's if you operate again at the COVID general recommendation of 5 exchanges per hour, but in the US, ACGIH said, well, you can install at this level, so which is a little higher, so you get more exchanges per hour, and then things start to become a little more negative. And you really don't win that much in terms of the benefit, at least for SARS-CoV-2. Now, internationally, these levels are not allowed. You need to install within this range. And then, you don't get as many exchanges per hour, but it is safer from the point of view of pollution. And if we add a line of 80% net benefit, so we save 5 people for every pollution death, this is where it lands. So it's in this ACGIH regime. So my recommendation is that, this is a technique that is valuable, but we need to deploy it smartly. Use it at lower intensities or critical locations where you have, highly sensitive immunocompromised patients or drug-resistant tuberculosis patients, or turn it on when needed. When you see there's a lot of virus in wastewater, then turn it on, but keep it off the rest of the time. And then again, add filters and activated carbon to mitigate the pollution. Now, there has been an interesting proposal that someone said, we could actually, based on the skin limitations, we could actually maybe run GUB 222 to protect for future pandemics or kind of bioterrorism pandemics, and run it at much higher intensities. These are much higher intensities, almost 1,000 times more intense than what we were discussing in the previous slide. If you run it that way, the disinfection will be in a second. So when a virus leaves an infected person, within a second, that virus is kaput. And basically, this will be a way to suppress a pandemic. If you could put this everywhere, you will get rid of airborne disease. Now, this proposal from this professor at MIT was done when it was based on an error in the literature where they thought the ozone formation was 100 times smaller than what it really is. So the problem is, if you did this, you would generate a ppm of ozone. So that would be a lot. If we study that case, that's what happens. So this is the high intensity case, and this is the line of non-net benefit. This is our base case, and this is the 5 to 1. So in general, this looks pretty bad. But now you say, well, you're not being fair. What about a really bad pandemic that's not just as bad as COVID, but is worse? It's 3 times worse. Well, let me show you that. This is a pandemic that's 3 times worse, or a period in a pandemic. And then, yeah, things get better, because there are so many pollution, so many disease deaths. This has a benefit, but still here, we have 80% benefit. So every time we save 5 people from disease, we're killing 1. Here we're getting to 0, and we're generating amounts of ozone of 50, 200 ppbs. So it's troublesome. I think there is some value maybe at the lower edge for really bad situations. I think the higher edge, I don't see how to do it, at least at this wavelength. Okay. So I've shown you now results for all these technologies. So this plot is going to summarize them. This is going to be the mortality benefit for the case study. In all cases, we're doing 5 equivalent ACHs, so they all have the same disease benefit. For the base case is the blue bar, but now some have pollution benefits for particles, or in red for ozone. This one we're not too sure. And then others have these benefits, again, due to ozone or particles, right? So what goes below is bad, and I told you, don't use these ones, use those ones. And then these ones, the UV, is good for disinfection, but, it doesn't have the benefit of pollution. Now, this is not the only thing. Of course, in the real world, a lot of things are driven by cost, right? And we have the cost of installation and the electrical cost and the sum of the cost. I don't have time to go this in detail, so I'm going to plot this against each other. So here we have the plot of the net mortality benefit of the different technologies and the relative annualized cost. And I'm told I have to do it for 7 years, and the power for 7 years, and amortize over 7 years, and then divide by 7. And we have normalized to the most expensive, which are these ionizers. And Okay, and the color here is used so that you can distinguish some that overlap. Okay, and we are not including all the costs. I just couldn't find information on this before the talk. So we're going to talk about the good, the bad, and the ugly, like that famous movie. So here we have the good. I would say these help with pollution, help with disinfection. You know, they should be our default choices. What about, I won't mention the bad, but I would call this the ugly, are these ones that really have a net benefit even during periods with quite a bit of disease. So we should just avoid that, you know. And then in addition, we're gonna call these ionizers and vapor ionizers the expensive. You know, it's like, these ones maybe have some benefit, but they're extraordinarily expensive, really 100 times or more than, no, sorry, in this context, they use little power, so but still more than 10 times more expensive than other alternatives. And the ionizers, the regular ionizers that make ozone are very bad. Okay? So I think we should avoid those. Now, this leaves us with these ones that are interesting, the electrostatic precipitators that we say they help with pollution and they help with disease, but they make ozone, so they have a negative effect. And GUV is very good for disinfection, but creates some pollution. So I would say these are the ones that we can use in some cases when we cannot tolerate pressure drops or when there are really bad situations, or, you know, we need certain things, but we have to be smart about how to do it and maybe do some mitigations. Okay. Now, many air cleaners that you would buy, and one more thing I forgot, yeah. Sometimes my GUV colleagues tell me, well, GUV is the most cost effective, and that is true if you only consider disinfection. But if you also consider pollution, this line has constant cost per unit benefit. And if you consider pollution, filters and activated carbon are in the same line as UV, not a different one. Okay. Now, many times people combine air cleaner technologies, and, you know, so combining filters with activated carbon, or an electrostatic precipitator with activated carbon, or UV with some of this, you know, that can be useful. But sometimes I see many Frankenstein air cleaners. I was reading one saying our best model combines 6 different technologies, and they were doing PCO and an ionizer and then a filter and whatever. And I'm like, why are they doing this? And it's really for marketing reasons. But I'm thinking, like, they're shooting themselves in the foot by using some technologies that work, that do damage, and then they're putting some bandage with some of the things that do work, and that's making the whole thing more expensive, and it's all for marketing reasons. So really don't be impressed. Simple is better, you know, and combinations of the ones that work is what we really need. Okay. So I've done a few sensitivity studies. I'm going to mention one thing, even though I won't show the results due to time, but actually the pollution results, the ones that depend on particles, depend on this limonene, or more generally this family of compounds called terpenes that we add to consumer products, to many consumer products, in very large amounts. And that's something we could change as a society. And it's not something that we can measure easily. Measuring costs tens of thousands of dollars. So we don't know how much they are in different locations. But we have a precedent when, for example, we realized that some components of gasoline that we call the aromatic hydrocarbons were really bad and made a lot of organic aerosol. This is a paper from the group where I did my postdoc with John Seinfeld and Rick Flagan at Caltech. And they published that, you know, if we change the composition of gasoline, we would reduce pollution. And we do this routinely, and oil companies spend billions of dollars doing this. So I think, you know, as these colleagues have advocated, we could change the composition of some consumer products, and this will have a big benefit with air cleaners and even without air cleaners. And I think it's something EPA should consider. And anyway, so my conclusions, sorry, I've gone a little long. Hopefully some people are still with us. So during the pandemic, we were all, including myself, obsessed with disinfecting the air. And all of these technologies, I show you, they all disinfect, but the cost per unit disinfection, the cost of purchase varies a factor of 100, the cost of including electricity a factor of 10. And many developers lost track that pollution is important. Now, to end on a positive note, you know, in the pandemic, everything was in a hurry. Now we know, and we have had time to digest this information, so we should now prioritize and have a standard, so the right air cleaners that have a benefit are deployed. You know, so when the next pandemic or the next wildfire smoke comes, you know, we are better protected at the lowest cost possible to society. Again, I told you, air pollution is a major cause of mortality, and outdoor pollution penetrating indoors, as well as pollution from indoors. Most of the standards and certification for air cleaners don't do anything. you know, I would say they're marketing gimmicks. Some of the ozone emission standards, they are partially protected, but I think those standards need to be relative to the amount of disinfection. And as I just said, I think we should try to reformulate consumer products to remove the species, the molecules that make a lot of aerosol. And finally, there is no silver bullet. We have some techniques that I will call win-win. There are win for disinfection and win for pollution, filters and activated carbon. Win-lose, you know, these additive techniques, or sometimes they call active air cleaners, and that's a marketing gibberish. The only thing they're doing actively is actively generating pollution, you know, and especially these hydroxyl ozone generators, PCO ionizers, avoid those at all costs. Bipolar ionizers are less clear, but you know, they have a small and potentially unreliable disinfection effect, and they are extremely expensive, so I would say avoid. Now, win-lose, but it's a smaller lose, GUV and electrostatic precipitators, to use them in some cases. And again, I haven't covered everything. Noise is important, maintenance, consumable costs, the waste, for example, from filters. These are all things that also need to be factored in. And I think a smart combination of techniques can help, but they also increase the expense and the maintenance. Okay, so sorry I went right along. That's all I had to say, and I'll take any questions.
Thank you so much, Dr. Jimenez. There was a lot of material that you've given our audience to digest, and we can, judging from the questions, there's a lot more than people would like to know from what you have shown. So we can start from, there's a set of questions that perhaps it's useful if you go back to the slide where you had mortality versus the different standards, and elaborating a little more on how or why those standards were not essentially protective. And it's quite a bit earlier.
Yeah, there. Okay. Yeah, this one.
Yeah. Yes.
Okay. So you just to discuss things in a little more detail.
Yes. Yes.
So
there's a lot of interest.
Yeah. So the thing is that, you know, to generate 5 equivalent changes per hour, many air cleaners like this one, the photocatalytic oxidizer, whatever, they generate a lot of ozone. And again, people have been dismissing is like, oh, here, maybe here is, so this is the line where it generates, or 50 ppb of ozone survive. More is generated, some is making particles. So maybe here we're generating 35 ppbs, and people are saying, oh, because this is below the occupational standard, or this is below the EPA outdoor standard, this has 0 effect. And that's totally not true. As I showed earlier, even having a ppb of ozone, or definitely 10, is enough to completely negate the effect of disinfection. So there is this very simplistic approach of taking, you know, very large amounts of ozone and assuming they have no effect, when the reality is very different. And we know this very well. The effect of ozone is important at a much lower level. And the same is for the effect of particles. So referring to these outdoor standards, I mean, it's what people do because we don't have the indoor standards. And again, these are a compromise between, you know, we know the outdoor standard still allows a lot of deaths, you know, but that's a different situation. Here we are going to put an air cleaner, we're going to spend money, you know, to do a benefit. We don't want to do a disbenefit. Okay. Now the ASRAE ventilation, well, it's like, yeah, ventilation helps. You see that these lines are inclined as we go up in ventilation, things improve, but they just don't improve enough. Okay, the ventilation is helping, but it's not helping enough. Let's see the other one. So, you know, the PM standard again is like 1 microgram is enough to do damage. So if we meet the standard of 12, that's, and the air cleaner is making 5, that's a huge negative effect. You know, in this case, I think it was making like 0.4 or something, and this is still negative. Now the ozone emission standards are the ones that are a little better, especially this one that's called the 0 ozone. They should change that name. It's not 0. 0 ozone should be really 0 ozone. And because these ones now, you know, if you run here, you know, now this air cleaner cannot do that and still have 5 ACHs, can only do like 1. But then, so you get less benefit, but you also get less disbenefit. And then if you limit now this, what they call 0 ozone, then again, it's a factor of 10 less. So then things get a little better, but it's still not, in my opinion, not good enough, you know. when we have air cleaners that don't do this. That's hopefully answers the questions that people had.
Thank you. And so just to verify, so essentially part of the reason why we you come up with these answers is essentially that these are estimates that for ozone and PM assume there is no threshold, or it's lower than what we have.
I'm calculating the actual health effects with the thresholds of the health effects. We see people die once PM 2.5 is larger than 2.5 micrograms per cubic meter. So we increase from 2.5 to 3.5. That's enough to negate the effect of this infection. That's different than EPA saying that outdoors there should be no more than 12, because that's incorporating other calculus of the cost to industry or whatever. It's a much more complicated problem of outdoor pollution. For ozone, the equivalent level is 26 ppbs, below which we don't see effects, but indoors that turns out to be equivalent to a lower number. And so we have a lot of deaths, even though we have levels that are below those outdoor standards.
Great, thank you. Then we have some questions about the recent ASHRAE standards 241, and I wonder if you feel comfortable commenting on that, and it's okay if you're not, and on whether the measures that are required there for using certain air cleaners would be protective.
I think the ASHRAE 241P and the great work that led by Bill Banflett and others is great. It's a great improvement versus what we had. It puts the disinfection in the context of these EACH units, and but basically in terms of the pollution standards, it resorts in all the standards. So it says, okay, it needs to follow the ASHRAE ventilation, and then it relies on other tests for ozone. I don't remember now if it's this one or that one. So it doesn't have anything that's more stringent than what I'm showing you here. So I think it's a good beginning. The standard can be modified, and once we publish this, I'm going to immediately submit a comment to ASHRAE saying you need to make the standard tighter, but that takes a process. I think it's a very good framework and it's positive, but it is not sufficient, and I think people shouldn't rush to install things now, without taking these health effects into account.
Thank you. There's also questions about whether you could go over again the assumptions for calculating calculating the mortality, and for example, how many people were estimated to be using air cleaners, and those assumptions.
Okay. Let's see. So, I mean, we can assume different things. I just, I try to do something that's realistic and that we come up with numbers that we can relate to, right? So I think for any of these air cleaners, installing them everywhere, we didn't do that for COVID, so I suspect we wouldn't do that otherwise. So now I assume we install this in a random 1% of US indoor spaces. So in a random 1% of US offices, homes, classrooms, airports, we install the same technology, and we see, so across all these different things, that's what's going to happen, right? And we calculate things in deaths per year, but again, that doesn't mean we have to do it for a year. We can do it for a month, and then use the numbers, get divided by 12, and that's all transparent. Now, the base case that I have used is the average level of outdoor pollution, the average level of indoor pollution and composition, and a level of disease, which is what we had last December, which is pretty high, but not as high as the early pandemic. So it was this, but was maybe a quarter of what we had in the early pandemic, but it was probably 3 or 4 times what we had this summer, right? So a level of disease that we can expect probably to have again this winter and the next winter. I mean, depending on what happens with COVID and whatever, but but it's not the early pandemic. And I show you some sensitivity cases, and of course, if we go back into a situation as bad as early COVID or worse, then the disinfection benefit increases and the pollution thing stays the same, right? So, and I show some cases there. So that, and again, it's the same for all air cleaners, you know. So you can argue, well, you shouldn't do 1%, you should do 3%. Well, it doesn't matter. All the air cleaners would translate together.
Okay, thank you. A big question, but that you have covered in some ways. But if you were to go on the market and evaluate air cleaners, what criteria would you use if you personally were in the market for an air cleaner?
I mean, I've been in the market for an air cleaner, and I have to be careful what I say, because at some point I'm originally from Spain, and my mom lives there, and she is at high risk. So I bought her this particular HEPA filter, and then I went to Spain when the pandemic ended, and everybody my mother knew had the same HEPA filter because they assumed I had checked them all, and it was actually something I found in 10 minutes on Amazon. But anyway, now that I have studied things a little more, let me see, where is this slide? 1 second. Here, so here, 6. So I would say, I mean, I would definitely consider, you know, what is the net effect in mortality? Does it help with pollution? Does it cause pollution deaths? I think that should be number one, you know. And then what is the cost is always going to be important, including the cost of electricity. And now, as I said, I didn't include the cost of installation, the cost of maintenance, how likely it is that's going to be maintained. Something, I have colleagues that say something that's going to be hidden on the ventilation system is likely to be maintained. That's something that's visible. You know, also consumables. Are we generating a lot of waste with filters? You know, what are they? You know, depending on how much electricity we're getting from solar versus fossil fuels, the global warming impacts. I think there is more of these factors, but I think we as a scientific community have the information. I didn't have the time to put some of these things together and get the information for all the air cleaners. But I think, you know, we can make rational decisions, but now there is no silver bullet, right? If people say, should we always do a filter? It's like, well, Corsi boxes are fine, but they use a lot of electricity, and then you generate a lot of waste. And you can say maybe if the electricity is from fossil fuels, you're going to generate a lot of CO2. Now the GUV is very disinfecting, but you're causing some problems with pollution, and you're not helping at all with outdoor or indoor pollution. You know, so and these ones don't generate as much waste, and you know, but then, you know, so there is no silver bullet that will say, oh, we should do this thing and it's always the best. I think it depends on our goals and some of these other considerations. And I forgot to put here noise. I mentioned earlier. Noise is also an issue. And now, you know, many times people who sell something will say, oh, filters are very noisy, and people turn them off. But of course, they take the noisiest filter. You know, there are Corsi boxes that if you run them in low, they still work very well, and they are not much noisier than other things. You know, I think 60 decibels or something like that, which is a very tolerable level of noise. So I think, you know, but we have to take all the things into account, and I think this is a piece of a larger puzzle.
Thank you. Then we have a set of questions essentially asking whether the calculations that you have shown, if they would change if people switched from, so if you switch the analysis from in-room devices to induct devices.
Okay, so 14. Okay, so it wouldn't if the duct is recirculating, right? So here we're talking about in-room devices, and the air comes from the room, we clean it, goes back to the room. It doesn't matter whether this is a box in the room or we go somewhere else and then we come back. You know, the analysis will be the same. Now, if there is outdoor air coming in, that still wouldn't change. It would just change the ventilation level. So in the plot, you know, if you have an air cleaner that has some, you know, or an induct system that has some ventilation, whatever, and you have you add some ventilation, so you're moving up here. Okay? So, but I was trying to keep things simple. So we're assuming that the air that's clean is recirculated into the room, and the part that's done by ventilation is accounted by this axis.
Okay. Another set of questions that I see that could be an important point is people are asking about the time of exposure. So the time of exposure for the pandemic being an acute exposure, and much of the literature on the effects of health pollutants being chronic exposures over several years. And I think you had something somewhere about that, but I wonder if you can address that question.
Yeah, I mean, it's air pollution over several years, but if the particle concentrations increase in a given year, so for example, we have a base case here, and this year that we have more pollution from wildfires, this year, not years from now, but this year, the deaths will increase by 200 because the average PM this year increased. Okay, so yes, there is some, you know, the time scales are not exactly the same, but we can annualize them both in the same way. So that's not really important. Now, this is different than, I mean, and the way you can address that, as I did earlier, is, for example, when we had an air cleaner, and then you say, well, now I'm going to apply it only during periods with very high disease. So this is how you can do it, right? In this case, you say, okay, if I applied only during the periods of very high disease versus this one that was periods of high but not very high, then things look better, right? So that's how you can compare basically when you apply things. Now, right now what I'm seeing, so my default case is we keep them on all the time, because I see, you know, these things are being, many of these air cleaners are being installed in ducts, and they're being run all the time because, you know, the manufacturer tells you this is good, you know, this has no disbenefits, we meet the EPA ozone standard and whatever, and you can keep this on all the time, right? So that's the default assumption. And that, as I said, we can run things smartly, so we can put UV and only turn it on when the wastewater data tell us that there is a spike in COVID, you know, and then once that passes, then we turn it off or something like that. I think that will be, or I mean, when I say UV, some other technique, but of the techniques that are more positive.
Okay. And then there's other questions essentially about the combination of different air cleaning technologies, which you spoke about, but so you talked a little about the case of UV and suggested to use in combination with the air cleaners versus the device that has been engineered to disinfect, but at the same time has other stages that reduce the air pollution. Is there some winning combination that uses costs there, so that they use a very low cost effective disinfection with a very low cost second stage to capture the air pollutants, for example?
I haven't studied that enough, but one thing that, and I know there is at least some devices, but they haven't been willing to give me a price. So for example, you can take an electrostatic precipitator that's very good about removing particles and combine it with activated carbon, so it's kind of cut here, that removes the ozone, and that's pretty good. Now, it's not necessarily very low cost. You could argue that maybe you can take GUV and combine it with activated carbon and a Corsi box or something, and that would also be pretty good. So those are, you wouldn't want to combine these two, and you wouldn't want to combine, you know, some of these things, you know, say we generate a lot of ozone and now we put a filter or to remove it, you know, that wouldn't make any sense. But among these ones over here, I think there are a few combinations that could be interesting. And then of course you have to think about the noise, the electricity, all the different things. But I think those we can think about and and some of them can have advantages. And I think especially for precipitators and UV, those are going to be essential to combine them with some of these other ones. I'm sorry, I'm making this slide really messy.
Thank you about that. Now, two questions that you may or may not have had a chance to explore in your experiments, but the first is about the role of maintenance of the devices or maintenance of the entire HVAC systems, and do we see effects that can be used in this analysis here? And the second similar one is really about the role of relative humidity and if it changes some of these conclusions.
So in terms of maintenance, that's a very important factor, and I think people who work on HVAC have known this for a while. But I think during the pandemic, it was clear that, for example, many buildings have, commercial buildings have what's called an outside air damper that controls how much outside air is allowed into the building. You know, so when it's very hot outside, you use less just to save energy. Those typically are broken in a third of the buildings, and they can be broken for years and nobody notices, and they can be broken shut. So that's one reason why I was saying earlier, we need to measure CO2, because then we notice the next day and not 3 years later. You know, so that's a problem for anything we do in ducts, you know. And a colleague was again saying, as I mentioned earlier, that the worst thing we can do is put something in a duct, because then nobody knows if it's working, and the people in the HVAC industry, you know, will tell you, oh yeah, we fixed it, we maintain it, and they may or may not do that. Many times they don't, you know, and people don't know. So I think that is, you know, we need to become more proactive, you know, in building proctors and people who need to become trained and be able to know what's going on. I think these local sensors for certainly for CO2, but I think also there is very good local sensors for particles, and if we put those in all the commercial buildings, that will be very useful. There are also some local sensors for ozone. They're not good enough, for example, for UV, but I think they will also be useful, and that will help us, you know, deal with some of those issues. Otherwise, we are back to, you know, that slide I showed earlier on, in which we have an HVAC system, but we don't see it. We don't see anything, and then, you know, things can go completely kaput. You know, now we still remember the pandemic. 5 years from now, we don't have another pandemic. You know, nobody's paying attention to the building, and things break, and nobody knows. Okay, so I think again, really, we need to do this thing, and I think it will have an enormous public health benefit.
Thank you. You mentioned at some point also about the residential products that don't have enough carbon to filter ozone or other VOCs, and are there affordable carbon filtration options that have enough carbon to make a difference that you have seen?
Yes, so there are, and and there are papers from colleagues. I mean, Rich Corsi and Attila Novoselak have done a lot of work on this, and they showed that the benefit of doing this everywhere, doing this in schools, will be huge, the economic benefit, but yet we don't do it, like we don't do many other, like we don't do ventilation, or we don't do enough ventilation that would also have a huge benefit, for example, in the schools. And once I realized the one I had bought was a gimmick and they actually didn't have enough activated carbon, I contacted Attila in Houston, and he told me, oh, there is this one and that one and that one. Of course, I cannot give names, but he told me one that was pretty good, and I immediately bought it, and we're going to test it. So, and it wasn't very expensive. I mean, that's the thing, that sometimes you can find things that are just as expensive or sometimes cheaper than things that are gimmicks and don't work. I mean, unfortunately, as a colleague was explaining to me, you know, during the pandemic, especially, many companies were making things, you know, in China or whatever for $20 and selling them for $2,000 and having huge profits, and some of those are the ones that hurt, you know. So anyway, so the commercial space is a mess, and there was a lot of abuse, and I'm sad to say a lot of corruption. I didn't see that so much in the US, but in Spain, in the UK, and in Argentina, I saw that basically the politicians would buy for schools whatever could benefit their friends economically.
Yeah, certainly. It's a potential conflict of interest there. So then there's a lot of questions about other different types of technologies, essentially, and how well do you think the ones that you have been able to test so far, how well did they cover the market? Is there any area, any specific type of technologies that is significantly different that would come to different conclusions from what you have shown so far?
I think I've covered pretty much everything. Now, as I said, the foggers, the hypochlorous acid foggers, HCl foggers, I haven't been able to do quantitatively, but I mean, I could be surprised, but I'm pretty sure they're going to be negative, or are going to have definitely negative pollution effects. Then there is also some other foggers that use hydrogen peroxide. Those I have had less time to look into. It doesn't strike me as a great idea either. Now, there are many air cleaners as you look at the commercial space that, and I was doing searches of air cleaners, and of course, all the Google, now every website I went to, they was showing me publicity for air cleaners, since I know I'm doing searches. And there are some that you just can't tell how they work. I think, okay, I think this is an ionizer, I think this is an extractive precipitator, but there is a lot of, oh, we give it a different name. And our score is called a dielectric barrier discharge or photoelectrocatalytic oxidation, and the tests, the informations that there are from the literature, and also there are devices that often combine many different technologies, so it's hard to tell exactly what's going on. So if people in the audience think that they have a technology that's different, that they haven't covered, send it my way, and especially if there is test data for disinfection and for pollution, then I can include it in the analysis. But to my, other than those foggers that I haven't finished doing, to my knowledge, I'm not remembering any technology that's major and that I am missing.
Okay, and I think probably the last or almost last question, would the results of the analysis change if when using ventilation, if that accounted for pollutants brought in from indoor air? I mean, from outdoor air, I'm sorry.
So that's in the analysis. So when we increase the ventilation, we bring more pollutants in from outdoor air, and then
that was factored in. Okay.
Yeah, that's already factored in. Now, if the pollution, I'm using the average pollution outdoors, and I mean, I've done the wildfire case, and then things get better. We have, if outdoor is very clean, then then you can. But I'm using the average of the U.S. So but that's already factored in. Something else is how much pollution, because indoors we have the pollution that comes from the outdoors. There is also pollution that's made, for example, from the consumer products that emit limonene, and then the ozone that's coming from outdoors. Those are making extra pollution, right? And that extra pollution depends on how much ozone is coming from the outdoors, and how much limonene is being emitted indoors. Those are in the model as well, and the ozone is changing with the ventilation in a realistic way that has been measured many times. And for the limonene or the VOCs more generally, we have, again, sensitivity studies, which I didn't have time to show.
Thank you so much. I think at this point we will stop. I want to remind people there were a lot more questions, clearly showing the interest in the topic you addressed. I want to remind everyone that still this is the personal results of the research of Dr. Jimenez, and some of these results are not published yet. And also he invited people to send comments his way. I think we have received some comments that we did not address in the Q&A, and we'll forward them to Dr. Jimenez as well. So thank you, Jose. Thank you everyone for participation and all the questions that you have asked. I want to remind everyone that this webinar is recorded and will be posted on our website in about a couple of weeks. and also remind everyone about the webinar on September 6th about EPA's own research on air cleaners and their regulatory framework. And with that concludes our webinar, and thank you so much.
Thank you for the invitation, and thanks for everyone for listening in today.